You're listening to Health Matters on Fox Sports 1380, presented by Integrated Rehabilitation Group. And now back to more of Health Matters with Maury Eskenazi and Shannon O'Kelley.
All right, welcome back to Health Matters. This is a very important topic we're going to talk about right now because a lot of us, me being one of them, I have parents that are in nursing home, and Kelly Smith from CarePartners Living Senior and Assisted Living Retirement Communities joins us. Thanks so much for coming on with us.
Well, thank you so much for having me.
That's better.
Am I there?
So yeah, I just
am I there? Yeah,
I do that just to make Tom roll his eyes at me because basically this is my first day.
Yeah.
Again, so tell us about CarePartners. Tell us what you guys do.
What CarePartners is we are assisted, independent, and memory care communities from Marysville all the way down to University Place. We're pretty proud of the care that we give our senior population.
And CarePartners, I mean, you said memory care facilities, but you do more than just memory care?
Yeah, we also have communities for people that just need, maybe they don't want to cook and clean anymore. And we also have communities for people that need assisted living but are not ready for memory care. But our standalone memory care, I think, is one of the things that really sets us apart.
What ages can you come and live at CarePartners?
In our assisted living, 65 and older. But in memory care, it's case by case. And the
Right.
reason is we're seeing people younger and younger being diagnosed with different forms of dementia right now. It's very scary. There was a woman online just this week expecting a child at 38 and has just been diagnosed with Alzheimer's.
It's crazy.
That is very scary.
Tell our listeners what's the difference between an assisted living community and a memory care facility.
In assisted living, you're probably doing a number of things very independently, but maybe you need some help with medication reminders or medication management. Maybe you just can't quite get that spot on your back in the shower. There could be a number of things you need help with, and maybe cooking and cleaning are an addition to that. Having a nurse in the building is very comforting for you and your family. Memory care, this is a very specialized type of a community. We have it situated so that people are not behind closed doors. These are people that really do need 24-hour supervision, but they also have to have things set up for them during their day to keep them not just safe, but also engaged due to their cognitive decline.
And it's a more one-on-one care.
Exactly.
Every resident has a full-time nurse that's assigned to that person, or do they work in a pod type situation?
It's more of like a pod. For example, we've got our most famous, I don't know if famous is the right word, but I think our most popular style of caring for people with different forms of dementia and the Alzheimer's disease that's so popular right now that we're seeing more and more of is the cottage brand. And what that is it's a smaller environment where residents have a lot more of that one-on-one with their caregivers, but also more hands-on with the nursing staff. The activities are more geared towards what they're able to do to help them feel successful throughout their day and give them better days instead of feeling more isolated, which is not anything you want somebody suffering from dementia to feel. But it's a smaller environment, which is nice.
Does that help dementia when they're around other people?
It does. When people tend to isolate, and what happens, and you'll see this a lot with people in the early stages of dementia, a lot of times what happens is you'll see that mom isn't doing the things she's enjoyed for years.
Right.
She's starting to kind of isolate herself from her friends and even eventually family because she doesn't want people to realize that she's not keeping up with those conversations the way she used to.
Right.
And that's very sad to see, but it's also mom protecting herself.
Yeah, and you know what's important? I mean, you mentioned this, Maury. There's a lot of people out there that with parents that maybe you're not living in the community with the parents, and you might talk to them on the phone or get feedback from the neighbors. What kind of things should our listeners look for in parents that maybe need some of this assistance, particularly memory care? Little tips for us?
Well, for example, normal forgetfulness might be walking around looking for your keys while they're in your hand. And,
Welcome,
that could just
that's
be...
my world right there.
Right?
Maury's world.
I know,
Exactly.
and I don't know, and I'm glad you're bringing this up because I don't know what normal memory loss and dementia means.
No, that's a good question.
Yeah.
That's a really good question.
But again, you and I could be having what we joke about as a senior moment.
Right.
But the truth is, having forgetfulness that interferes with your day is not normal aging. What happens when we have a normal day when we forget something? You can't remember, what's that guy's name? Remember that song we liked? What was the name of that band? I can't find my
Styx.
keys. Thank you,
Yeah,
sticks.
okay,
I'm
yeah,
glad
yeah.
you remembered that.
Always
You're
sticks.
such a good guy. It's always sticks. But my point is, but when you have dementia, it's the roadmap that's missing. It's I've got my keys. I don't know what they're for.
Yeah.
I can't find the bathroom in my own home. I get down. I've driven this route for the last 20 years. The grocery store is 3 blocks away, and I can't get home. It's those types of things that now maybe it's time we sit down and have a family meeting and find out what else is going on. Are there prescriptions at Mom's house that she's overtaking or undertaking?
Yeah, that's dangerous, isn't it?
Is there, is the mail in the freezer but the steak's being left out? Are there things in the refrigerator that become science projects? A lot of times what happens too is families will bring in caregivers during the day to help out with Mom, but are we making sure she's safe at night? The pathway to the restroom, are we making sure those things are lit well? And just different things. Are you looking at what's going on in the home when you're not there?
And they all have animals pretty much, and that's also a hazard, walking around at night, tripping over your animals and stuff.
But with dementia, you also have to take a look at, can Mom take care of that animal?
Right.
Do you notice that she's not cleaning out a cat box, or the animal is not using the proper ways to alleviate itself?
Right.
Is Mom being able to keep up with those types of things? And is she making excuses for Dad? We see a lot of that too with married couples, is that Dad will start to have some memory issues and Mom's got a ton of reasons why he's okay. And kind of hiding from some of that. But the truth is, most of these people, in all honesty, they don't want to be isolated. And when they do isolate, they do tend to decline a lot faster. So getting them with other people that are in that same cognitive ability as them, what you do find is that they do tend to level off, again, depending on the type of dementia they have.
Tom?
Talk about people and their hygiene, because I've heard and people I've known that kind of their hygiene kind of goes to the back burner.
A lot of times with dementia, and it depends again on the form, but what can happen is that we hear a lot, I'm cold. So like in our communities, one of the things we really try to do is make sure the bathroom is warm. You already have warm water going. You have their bathrobe out. You have things ready to have that a warm environment. Dementia residents do not like to be cold. Also, a shower. Maybe Dad's taken a shower for the last 40 years, but now he's in a situation where there's water in his face. He's already confused. He has a stranger taking off his shoes and his pants, right? Are you having a conversation with that person, regardless of their cognitive ability? Are you telling them what's going on and asking for their approval? You wouldn't take a total stranger's clothes off without asking them, right?
Right.
Hopefully not.
Right.
Why would you do
So
that?
So it's not
right?
necessarily an aversion to water. It's an aversion to being cold.
And it also can be an aversion to the way they're being handled. Is somebody explaining to them what's happening and how we're doing it?
Dad, hurry up and get in the shower.
Yeah,
It's
exactly.
not the way to do
That's
it.
not the way to do it. I'll give you an example. At the cottages at Mill Creek, we're jokingly known as the home of the 7-day shower. And what that is you might get this arm on Monday and left arm on Tuesday. Sometimes you have to be creative with that, but you also have to make sure that you're understanding why that resident is resistant to that cleaning, process. Is it the shower? Would a bath work better? Are there other products that you can use to help that resident be clean without scaring them?
It's one of those things, Alzheimer's, dementia. I mean, anybody in this room right here, I think all of us have known or someone who's affected by it, some family. And it's not just the patient or the client, it's the family that really goes through a lot of, because it's hard to see a loved one go through this. And I bet there's a lot of support opportunities for not just the client, but the client's families.
There really is. We refer to it as mourning a living person.
Right.
Yeah, right.
Because
it is.
Mom's there,
Yeah.
but she's not there.
Yeah,
and
it's hard.
and it's
horrible. It is horrible.
Of all the diseases people can get, I tell families all the time, this one's straight from the devil, because of what families go through. So one of the things we try to do is offer support for the families. There's many wonderful support groups. There's the Alzheimer's Cafe, which you can learn more about online. But there's a lot of good places for people to go and talk to other people that are not just professionals, but also other families going through what they're going through. So they realize, you know what, I'm not alone.
Yeah, I recently had a chance to talk to someone from the Washington State Alzheimer's Association, and the statistics on it's alarming.
It's scary.
It's alarming. I mean, just the government, just being able to fund the care. Talk about funding, because that's a huge issue for families. How do you work that out?
Well, with funding, one of the things that, if I could say anything to anybody who's listening right now, the one thing that I would tell you is if you do decide to place a loved one in a dementia community, do not let somebody talk you into something you don't need. Do not let somebody talk you into, guilt you into purchasing something for your loved one that is way beyond their means.
How do you know they don't need it?
Right.
I mean, when someone's talking you into it, I mean, how would you know?
Well, you know what your parents can afford, and you know what's within their budget. In all honesty, memory care is expensive. We just did some research this week online, and again, this is information anybody can find, but the annual cost of long-term care in a skilled environment, $90,000 a year and up. Adult family homes and assisted living communities, $30,000 to $75,000 is the average a year. Home health starts at $25 an hour to $200,000 a year and up to have somebody come into your home. So when you look at those kinds of pricing, the first thing you have to ask yourself is, what do I do if mom does run out of money? If she outlives her savings. And I can tell you this, in CarePartners communities, and there's a number of other good companies out there that also work with the COPES program, which is money our parents have paid into their whole lives. There's no shame in excess and getting a hold of that money. But the truth is, any community that will allow your parent to stay in their home on Medicaid or the COPES program is probably a really good option.
Right.
Mm-hmm.
Yeah.
It's amazing. It's amazing.
It is amazing.
Thank you for your work that you do in this, because it's not easy.
CarePartnersLiving.com is where you get more information. And, man, that was fantastic. Thanks so much for coming on with us.
Thanks for having us.
That is it. We want to thank Kelley Smith for coming on with us. Again, CarePartnersLiving.com. Dr. Yusot Sleva from UW. I know I'm so good at that. UW Neighborhood Smoky Point Clinic. And Mike Rohrbach from Run to Win Outreach. Again, their big dinner is Friday night at the Linwood Convention Center. That's it for us. For Tom Lafferty, for Karen Mork, I'm Maury Eskenazi.
I'm Shannon O'Kelley. Stay fit and stay healthy.
Health Matters. The content of Health Matters is intended for general information purposes only and is not a substitute for medical diagnosis or treatment. Individuals with health problems should always consult with their healthcare provider for professional medical advice, medications, or treatments. The views expressed by show hosts and their guests are their own and are not necessarily the views of Integrated Rehabilitation Group or this station.